Yes, hello, good evening, and how are you doing? The time is 8 p.m. here in Nigeria. How are you? My name is Dr. Frederick Unigbohai, and people call me Dr. Fredostar. I'm a licensed medical doctor. Now, today's program is Ask the Doctors, holds every Sunday by 8 p.m. But I want to be sure that you can hear me, right? Yes, I want to be sure. Let's see. Okay, so my volume is low. Let's see. Can you hear me loud and clear? If it's clear, I want to be sure that you can hear me. Huh? Yes, if you can hear me, just let me know that I can hear you. And if you can't hear me, let me. Let's see. Yeah, let's see. How are you now? So, we are having a question and answer session tonight. Today is a question and answer session. Eh? Let's see. Can you hear me now? Okay, let's see. Pamela, how are you? Yes, how you did? Okay, the sound looks better right now. Okay. Oh yeah, tell me. Let's see. Yeah, it's not audible. Why is it not? Volume is perfect now. Okay, somebody says Helen is not audible. The volume is perfect now, right? Let me know. So we will take your questions tonight. If you have any question for me. Betty, good evening. Happy Sunday to you. Yes, I can see you. Who is this? Your voice is not loud, but I think it is better now. Let me know. There is echoing at the background. Yes, it's from this device. Don't worry. I'm done with that right now. Yes, it's okay now. Fine, thank you. So if you have any question for me, let me know. Your voice is not loud. It shows blurry here, not clear at all, and not audible. Well, I know why it's not clear, and I can change it. Let's see if I can do that right away. Yes, let's see if we can do that. So three, two, one, and let's change. Yes, let's change. So yes, it is clear now. Yeah. Okay, good evening, everybody, and how you day? So if you get any questions for me tonight, sharply, let's see if we can take your questions. If you have any questions for me, we can hear you now. Yeah, okay, fine. Thank God. Yes. If you can hear me, okay, good. Where are you watching me from? Where are you watching me from? Don't ask question if you never tell me where you watch me from. Betsy, how is the camera right now? I think the camera is better. Huh? Yes. Okay, let's see. Who they here? Oh yeah, tell me where you watch me from. Quickly, before you start asking me any question. Oh yeah. If you no go if you no go tell me where you watch from, Omo, why you dey run this package now? So let's go quickly. I have comment from who? Um, Abraham says, is not having sex for long, can it affect someone? No. The answer is no. Huh? Thank you. Watching from where? Akure. Okay, I can see. Oluwatoyin. From where? From Lagos. Okay. Roslyn is watching us from Germany. Um. Okay, let me see. Oh yeah, let me see. This person never tell me where she dey watch me from, but she dey ask me question. Okay. Anytime I sit down for long, I do feel pain at the back joint of my knee. What could be the cause? Anytime you sit down for long, you've already given yourself the answer now. Sitting down for a long period of time can actually cause you that problem. So the best advice I will give to you here right now is that don't sit down for too long. I don't know your body weight, if you are overweight or you are within the normal weight. But if you sit down for long, it can cause you a whole lot of problems. And I think you don't want that. Huh? Yes. Let me see quickly. Doc, I'm not fine. No, I have been down with some issues: spinal arthritis, lumbar spondylosis, degenerative disc disease at my young age. On physiotherapy, maybe because of the weight loss product I took. So, Pamela, sorry, who made this diagnosis for you? Hmm? Sorry, spinal arthritis, lumbar spondylosis, degenerative disc disease. Who made this diagnosis for you? And when was this? There's a reason I'm asking you, because you mentioned weight loss products, and I don't know why you are taking weight loss products. You know, I have warned you on this platform that don't take any product for weight loss. But I don't think your problem is because of whatever you took. So let me know. If my audio is very clear, please comment. I need to be sure that the audio is very, very clear. Okay, we have Dr. Israel in the house. Dr. Israel is in the house. Thank God. Dr. Israel, if you are ready, give me a thumbs up. Huh? Okay. Dr. Israel, how you doing now?
Okay, fine. Good evening.
Yeah, good evening. Welcome. Okay, we get a lot of people in the house, but you did hear me?
Yeah, they hear you, but your voice just the whether not faint or say it faint, I never know. It faint somehow, but I dey hear you.
Okay, no problem. So I'm gonna fix the audio now. When you take the next question. Mm, okay, see this comment here. It says, Doctor, my question is, someone said eating and drinking water at time is bad, that when you are done eating, then you can drink water. How sure is that?
Well, many people get many things where they don't dey talk about you drinking water when you are eating or all that. But for me, I will say if you dey eat, if water hungry you to drink, I better drink. Imagine say you dey eat hot food, e can't burn you. You can't because say they say don't drink water because you need to drink it after. You know that kind of burn when go burn you through your throat, they burn you, they go belle. You not say you not put water to stop it. So please, if you are eating and you feel like taking water, please take. There's no bad thing about it. There's no bad thing. So if you feel like taking water, please take. Yeah.
Okay, so we are back. Can you hear me now? Oh yeah, let me know if you can hear me. Hello.
I'm not hearing you. I don't know if others are hearing you.
Okay, no problem, no problem, no problem. I know, no worry. I did try fix the audio. Try fix. I did try fix. Let me see. I'm trying to fix the audio. But let's see, Sha. Okay. Can you hear me now? Hello? No, they cannot hear me. No, I do one like this. Okay, so I think they said my voice is low, but I think it should be better now. Alpha, you hear me now?
Yeah, faint, faintly.
Why waiting make am faint? Make am faint. Waiting make am faint. I don't know why.
Okay,
Why you faint?
it don't come up now. It don't come up
It don't
now.
come up, Abi. Okay, good, good, good. So they say my
Yeah.
voice is low. Don't worry, we don't try improve them. Okay. So let's try to be fast. I have wound on my leg for over 6 years. I have checked my sugar test and I'm okay. What can I do?
Sorry, I don't know who check your sugar test, so you need to go hospital, make they check the wound. Yeah. So there are different things when fit dey that wound will make an never heal. When fit be say that wound they infected, yeah, when make an never heal. Fit be say you not dey even treat am well, and the position where the wound there. And another thing is that if fit be say that wound don't change, come off from normal wound to something else. uh So you need to go to the hospital, make they check that wound, make they look am, make they even collect some things from inside the wound, go test am to know wetin happen, wetin dey sup for the wound. Yeah, so that make dem for fit give you the correct treatment. It's not only just to do sugar test. Yes, sugar test, we know say if person get sugar many for the bloodstream or for the body, sometimes go the healing process go dey slow. But that's not the only thing. So please go hospital, make dem check her, make dem check you very well and know wetin dey cause am. Dr. Fred.
Okay. Now for the person wey talk say she get wound for leg, if your wound don dey enter 6 years, for medicine that one na wetin dey call chronic leg ulcer, and no be small something be this one, abeg you. So you go need to follow the advice wey Dr. Israel give you. Oya, share this video. If you never share now, I need you to share. The voice is okay now. Is okay now. I have wait first. See, let me be sure that they share this video. Let me be sure. Let me be sure that they are sharing. Only two people now don't share, Dr. Israel. Only two people and I don't share, and it don't tire me. So make we look for the people we share and make we take their question. So I want to check the people we share this live session right now, and then now their questions we go take. Hmm? So that the rest people, when they don't share, we will now come back to them. Okay, so I'm checking right now. I'm checking the names of the people we don't share. Let me see. Izu Gold. Okay, so let me take your question. It says, I've done that already, but they refer me to tradition. Who referred you to tradition? Please explain. I beg, explain. Pamela, so I see you. Pamela, if you have a question. Oluwatoyin Yetunde, I can see you. Let me see. I dey check the people we don't share right now. Let me see quickly. Let's see. Let me see quickly. It says, doctor, waiting fit cause low blood pressure. Them talk say my BP low. So Mary, this your question, it shocked me. You know why? I don't do video on low blood pressure. I don't explain waiting be low blood pressure, waiting they cause low blood pressure, and waiting you feel do. But maybe you know watch the video, because some people go tell and say and then get low BP. We go ask you, who told you you have low BP? Where did you go? Did you see a doctor? Because not be everybody will get low BP be problem. Some people their BP is low and they are still very fine, no issues at all. So when you say you get low BP, who check you? Where then check am for you? Do you understand? This is very important, because people go they shout, I get low BP, I get low BP, but not be everybody true gets low blood pressure. Okay, so let's see. We have answered you. Okay, Dr. Israel, Theophilus says, I have waist pain for 1 year, 7 months now, and it's serious.
Oga Theophilus, abeg, you need to see an orthopedic. those doctor wey dey specialize for bone, yeah, make dem check to see if you get any problem with your weight with the bones wey dey that side, wey dey wey dey that your waist region, yeah, all the bones wey dey that waist region, they need to check am to find out. Now, one thing about bone injury or bone pains is that sometimes bone pain, there are some, if they don't get injury wey dem no go fit repair, dem no dey fit repair am, you go only dey manage the pain, and you go only dey manage the pain, or in fact some of the case maybe na to go do surgery to take correct those pain, for some cases. So for you to dey get chronic pain like this, you need to make sure say you follow your doctor's talk. They go need to do maybe CT scan for you and all those many things to check that part of your waist and to know what else. And it also depend on your age, because some other things fit even make your waist make you dey get low back pain. If your age don pass, you need to also e don reach 40 and above, you need to check your you need to check PSA, that is your prostate specific antigen, that is, you need to check your prostate, because if there is problem with the prostate, it fit cause waist pain. Yeah, it fit cause waist pain. So it also depend on the kind of work wey you still dey do. So if na the kind of work wey you dey sit down for one place for a very long time, e fit still dey give you waist pain, continuous waist pain, mostly if you don first injure the waist before. So those kind of work, even when you work wey dey make you stand for one place for a very long time, so those kind of things, you need to once dey stretch yourself, and those go help to reduce your pain. And also you need to, if the chair wey you dey sit down no be chair wey go make you sit erect, you go need to change your chair, that's your work chair, yeah, so that make your body for dey kampe as e suppose be. Dr. Fred.
Yeah, thank you so much, Dr. Israel. Now, if you dey watch this video and if you dey see us for the first time, this program we dey do am every Sunday. We don dey do am come enter more than 5 years now, every Sunday. And we don talk about plenty health condition, plenty ulcer, high blood pressure, liver, hepatitis, many things, HIV. So if you come like this, and you get some questions where you go ask us, we don't discuss them well for the page. We don't answer them well. So that when we tell you, say, you go need to go watch our video again, so that you go know, you go fit sit down, understand, because we don't answer plenty things well. And we go always tell you, say, this place no be hospital. So you cannot come on social media and they tell us, say, may we treat you online. We no fit treat you here. Here no be hospital. You go need to see doctor. But if anything there wey no clear for your eye, if there's anything that is not clear to you, you can ask us and we can explain, because we know they see you. We know if we tell you, say, go and drink this medicine. We don't know whether you get big head or small head, or whether you fat or you thin, or whether you tall or you short. We don't know anything about you. Now, only the comments where you they ask. So we dey careful, yeah. We are licensed medical doctors. We get medical license, and anything we dey talk, we dey careful, so that we no go just open mouth they talk because we want followers or we want me you like us. No, now the things we go help you, we go explain to you here and tell you, say, true, you need to see doctor. Yes. Okay, so let me appreciate this person first. Betty sent 400 naira. God will bless you for your time and sacrifice. Betty, thank you so much for this one where you do. God bless you. If you get 10 questions for me today, send them. No worry, we will answer you. Okay. I have been treating sugar. For 1 month now, and it's not reducing. Anything to do, please? Dr. Israel, you want to respond to this?
How you take dey treat sugar? Who dey treat your sugar for you? Yeah. If you are not treating it the right way, you know you are not supposed to get good results. So follow the right channel. If now you just go lab, go do test. I will tell you, say you get sugar, you are diabetic, or you get sugar for body. Sometimes some things when they say when I get sugar for body, if it just be the normal sugar. Imagine somebody just wake up in the morning, never eat. You do a fasting blood sugar, you get 90 something or even 100, go they complain, say, hey, he is diabetic. Or somebody you only drink coke finish, you go do fast random blood sugar, they see 300, you go dey shout say you are diabetic. Ooh, they tell you that one. So that's why you need to go to the hospital, see your doctor, let your doctor examine you, be sure that yes, you are diabetic, then he go give you the correct drug. And if na hospital you go and then you see they say you never dey get relief or nothing don change, abeg change the hospital, go better hospital, go government hospital, and general hospital, teaching hospital, and go. They will give you the correct stuff, and you get better. That's if na really diabetes, if na really sugar na full your body. Dr. Fred.
Yeah, thank you, Dr. Israel. So let's take the next question from Pamela. So this is a continuation. It says, I was feeling so much pain on my back. I thought it was the normal pains when stressed, which I have been experiencing after my last set of triplets. But when it intensified after I fell badly from a bike, I had to consult with an orthopedic surgeon at the government hospital and was asked to do some radiological investigations. No problem. The result traumatized me. So, Pamela, I now understand. So sorry, Pamela. I'm very, very sorry. So now I understand where you got your diagnosis from, and degenerative disease. I think you have lumbar spondylosis and arthritis of the spine. I'm so sorry. And right now you don't see orthopedic surgeon, so I understand where they go on. No be sweet diagnosis. I beg, follow the advice where the surgeon give you. Because most of these spinal issues, the best way now you go to cope with them. Not most times, no permanent solution. You get why I mention like that. I'm so sorry. Your physiotherapy continue. Yes. I'm so sorry. That bike where you fall from also might be one of the reason we also trigger most of all these things. Sorry. Yes. Let's see. Let me take some more questions. So we have a question here from Oluwatoyin Yetunde. He says, how can someone take care of a toddler with frequent infection? And what tests can be done aside the full blood counts and urine MCS? Going and coming back infection of a child below 10. Dr. Israel, won't respond.
Now this child wey dey talk na girl abi na boy? What kind of infection are
Mm,
you even talking about?
mm.
What kind of infection are you talking about? Na boy or be na girl? Your environment, how is your environment? Because to stop infection is to take care of your environment. The first thing is to learn to teach the child hygiene, to make sure say the child understands say if you do anything, you need to wash your hand. Even if you say it's below 10 years, it means say e go dey maybe 8 or 9, e go don understand, e go don get sense. So you must teach the person how to wash the hand all the time after anything you do. But the first question when you need to answer is to know if it's a boy or a girl. It's very important. That will also guide your doctor on what to do. In fact, when your doctor see your child, they go know what next to do. Yes, there may be other tests that they will need to do apart from MCS or full blood count. Full blood count actually give you a coverage of almost everything where they happen to person body. So football can they always they give that. So it depend on what the doctor see. Now go take request for any other investigation when the doctor think say na the best investigation for that child. But for you, make sure say your environment they clean. Make sure say whatever the child they use they clean. And teach the child how to wash their hands. With that simple thing, and make sure say they give them balanced diet. With those simple things, you just be saving your child from a lot of things. From a lot of things. Yeah.
So you say the child na girl, urinary complaints all the time, and my house is always clean. So you don't respond quickly, Dr. Israel.
Okay. If the child na girl, so you need to teach her how to clean herself after urinating. And after using the toilet. So remember, say sometimes some of them people say they introduce as they try to wash their bum or use tissue paper, they fit introduce dirty enter their front part. So that may
Mm.
also cause the the many infection when the child they get. So you need to teach her how to do that first.
Yes,
So
yes,
when you
yes,
teach the
yes,
child
yes.
how to do that, it will help to reduce a lot of infection, all those urinary all those infection when you dey talk about. It will help to reduce. It will help to reduce that. And I also hope say okay, I stop for there. Dr. Fred.
Thank you so much, Dr. Israel. If you never share the live session, please share. We have a lot of questions, and I did try respond to the people we don't answer us, ask us since. Okay, let's go to YouTube. YouTube. Betty says my 4 years old son is getting slimmer, although he doesn't eat much. I think I have to pet and force him to eat. And he was chubby before. Please, doc, should I be worried or is it normal?
Well, it's because your child is not eating much. That's why it's not getting fat. And another thing, most children, when they're fat, when they're small, does not mean that that fat will remain with them continuously. No, not all of them will
Mm,
be like that. Also, what's your own stature and your husband's stature? Una fat, una not fat. You don't
mm,
really need to be looking for. You don't need to. You don't worry yourself that your child is not fat. If you and your husband is not fat, and also if your child is not eating well, that may also lead to reduction. So you need to fortify whatever is eating. Yes, he may not eat many food, but if he's eating rich diet, a fortified rich diet, getting all the nutrients, and you see say e go dey well. Also, no dey look for fat. Check the body, the
mm,
skin of your child. Is it very fresh? Is it looking, is the skin shining? Is the baby healthy? And those are things you also need to dey look at. If the pikin dey healthy and the skin dey shine and is doing very well, abeg leave your pikin. No stress yourself too much. Make sure say e dey eat. That's just the most important thing.
You dey hear? So this is a very, very good. And please, I beg you, if you never share the live session, share the live session. Invite your friends. Before we continue, I want to say this again. If you be content creator, if you dey post content on social media, I am very, very serious. I have made it easy for you to get my course. Look on the screen. You will see this code on your screen right now. I don't know if you can see the code on your screen. Huh? Look at the code on your screen. Scan this code and get the course. And the reason why they talk, I know why I'm saying this here. A lot of men, women, businessmen, businesswomen, young women. I won't make money on internet. They talk, say I feel this. I understand. But if you do some wrong things, it will affect you. I don't do this course. Scan the code on your screen. If you can see the code on the screen, scan the code with your phone. It go carry you go the course. See this code wey dey your screen. So scan am. Automatically, you go get the course. It dey very, very cheap. And anything you want for that course, it will help you. If you want to ask me questions about content creation and many, many things, inside the course, you fit ask all the questions and I go take my time answer you till you understand. So hurry up, scan this code wey you dey see for your screen right now. Scan am and no waste time. So let's go back to the questions and take one question here. Let's see. Okay, it says, thank you. He's actually glowing and he looks healthy. Very fine. Okay, let's take this question quickly. It says, Dr. Fred, I did a scan in UATH and they found out that there is a zero point 0.5 centimeter renal calculi on what? On the mid what of the right kidney. Please, what could be the possible cause and what to do? Mr. Jude Okuchuku. So, ma allow Dr. Israel respond to you.
I believe say when you do the scan, you mention the name of the hospital, you mean say na teaching hospital. It also means that they must have sent you to see a urologist. That is, or yes, a urologist. Some doctors where they specialize in kidney and all that. So if they have referred you to see such people, I beg, go ask them this question when you ask us. Seriously, go ask them this question when you ask us. Because they are the specialists in it. They will give you the correct every answer what you need. However, what I can tell you is that if you know they drink water all the time, it means say you go to get uh, concentrated urine when they conk, when they yellow well. And with that, sometimes all those dirty wey suppose dey comot for the body, wey the kidney suppose dey comot, they no
Mm.
comot, or come dey hide for so some place. Now all those things now they come form stones. And the only way when you go fit take remove them na still to drink a lot of water so that make it wash those things comot. So I don't give you wetin I know, but if you want get more information, I believe they referred you to see a urologist, see your neurosurgeon, and all that. They will actually give you more info and other things to do. But now water, you need to drink a lot of water. You need to be taking a lot of fluid and
Okay,
leave alcohol.
so yes, thank you for that. Yes, take a lot of fluid, leave alcohol. Very good one. Let's take this question quickly. The questions are plenty. It says, who be this? It says, what is the cause of stretch marks? Your name na Itunu Oluwa. What is the cause of stretch mark? Now, stretch mark, make we explain, me you understand. You see nylon, right? Your normal nylon where we they use the black nylon. It dey as e be. You get how you go draw the black nylon. You get how you go dey dram. You go see say the nylon don dey, e go dey give you sign small small as you dey pull am, right? Now your skin looks like that. For almost everybody, the skin dey intact, but e get some kind things wey e get some conditions wey fit make that skin pull like that. Go come dey give you those marks. One of them na when somebody don increase in body weight, obesity, fat. You go notice say when people dey fat, that ability of the skin to dey strong, e go weak. You go see say the skin go come dey like e dey pull small small. Go dey give you those signs wey you go dey see as if say nylon dey pull. That one na one. Number two, some people e get chemicals wey dey for their cream. When you apply those chemicals on your skin, those chemicals small small go dey damage the skin, go dey give the skin as if say e wan dey weak. E go dey pull like that. You go dey see am, e dey pull. When woman is pregnant and when the woman get belle, you go notice as the belle dey big, as the baby dey grow, that her abdomen, you go see am, e go dey extend, e go dey extend. Small small, you go dey see say this woman dey get stretch mark. You go see say the woman dey add weight. Small small, you go dey see am like that. E dey for their body. So these are some people too, e fit even be for family. You go see them for the family. Everybody just get am because of the nature of their skin. And some other ladies too, where they do all this bleaching, we dey see am for their body. So these are some of the things where they cause stretch mark, especially when the skin go through some kind of stress. You know, can't get the kind normal strength where you get. You can't dey weak, and any little thing you fit see stretch mark for that. And though it's more than this, so even some people where they use some form of contraceptives, they fit still see stretch mark for their body. So it's very, very, very big. Yeah. I don't know if Dr. Israel
Some
want to
kind
add
of
anything
cream
so
when
that we
some
can.
people still they use.
Yes, some kind of cream,
Some kind of
correct.
cream when some people still they use. Pregnancy fit cause the stretch mark because it's that one you go quickly see am for the abdomen because the belly, the muscles, the skin for the belly don't expand. So sometimes you also see it in your tummy there. Yeah.
Okay. We are not sharing the live session. It says, thank you, doc. The pains are so severe, but I'm scared to take painkillers, thinking it can affect my internal organs. Now, I don't know how safe it is to take anti-inflammatory herbs like turmeric, ginger. The doctor advised that I lose weight. I lose 25 kilograms. How is it possible without taking those detox tea? So, ma allow Dr. Israel respond, especially for that person who gets spinal stuff and the other stuff.
Pamela, Dr. Fred tell you sorry. So make me tell you sorry. Sometimes these things are neither here nor there. Yeah, you get where you do some things which you go sit tell you say not do them again. However, taking anti-inflammatory medication no, is not bad, but don't overtake them. There are sometimes where the pain will not be so severe that you can even do your activities without, even when the pain is there. And during that period, I will advise not for you not to take. But when the pain is very severe, yes, you can take once in a while. You just take, and it is very possible for you to lose weight even without taking all those whatever things. Use your diet and you do small little exercise, not serious exercise. So it will take you time, but you still have to do it. You still have to do that. Also, another way to even make sure all these things go, mostly for when you get all these arthritis, sometimes they'll tell you say may you see do small work with those things so that as you continue doing it, you get used to it, and sometimes the pain reduces like that. So yes, you can still lose weight. You don't really need all this detoxing, whatever. Little exercise and your diet. With those ones, I think you'll be able to lose weight. And when necessary, you can actually take your anti-inflammatory tablet. All those turmeric and this thing, yes, it's not bad, though, but they may not reduce your pain.
Yeah, thank you. Let's see. We have a lot of questions. This live session at 8 p.m. to 7 p.m. And if you come late, sorry, we did try work with time. Dr. Fredostar, thank you. I have been following almost all your videos. I made a lot of corrections for the food I used to eat through your videos, and it's really helping me. What are good foods for? Is this high blood pressure patients? Is it the good food for high blood pressure patients? I want to assume, right?
Okay. If we there, or should we wait for him to really clear that if it's high blood pressure? That will not go talk 2 times.
Abi, make it clear. I'm okay. Make it clear. Make it clear. Make it clarify. Yeah. Let's see. Okay. Okay. So we have a lot of questions here. And this person says, "Good evening, doctor. Well done. So I'm feeling many body pain, all my joints, all part of my body, all is paining me. Sharp pain, chest pain, waist pain, burning sensation. Sometimes headache, dry lips, white tongue. Sometimes my throat is paining me. Sharp on my foot. Last Monday, I went to the hospital. The result is nothing wrong with me, though I have hepatitis, but it's not even detecting for the result. How possible is that? What is scaring me? The doctor told me that everything is okay. So I can deduce that you went to do tests. You didn't go to the hospital. You understand? I went to hospital. The result is nothing wrong. So I think in a lab, this person go. Okay, Israel, and this person go lab.
Well, um, I let just follow what he said. Say he went to the hospital. Another thing is that maybe the test where the doctor do for you not be the test where you need to do for you because of whatever they do you. You say you get hepatitis and the test did not show. Did you even know if he did hepatitis for you? So if you not do hepatitis test for you, he not go show hepatitis because that was not the test he did for you. So maybe he just did some simple test and he noticed that you don't have those things. So I will advise you go to teaching hospital, go to government hospital where they will do a lot of investigations. There are some investigation they do and they call it routine investigation, and there are specific investigation that are very good for almost everybody to do, like a general test. So please, brother, I believe it's a brother or a sister. So please go to a general hospital and let them see you and run all the, because yes, you may have a very serious thing that is troubling you for all this body pain, white tongue, or even the white tongue when I hear say get test where you're supposed to do. when I don't think if they even did. Okay, so that they can do a lot of investigation for you, and then you'll be able to know what is wrong, and if there are medication for it, you'll be given. Dr. Fred, we
Oh,
not dey
sorry,
hear
sorry. I
you.
know. No, sorry, I mute my mic. Sorry, no vex. Okay, so this person is saying, what is the cause of TB? TB is caused by bacteria, Mycobacterium, bacterial tuberculosis. Now, they cause tuberculosis, TB, and most times, they affect the lungs. However, if it affects other parts of the body, so tuberculosis now bacteria they cause them, and the way people they get them now when you inhale, maybe somebody get and sneeze, he cough, you can't enter the body. If you enter the lungs and cause problem, if you also affect other parts of the body, if you affect the bones, if you affect your spinal cord, fit affect even the genitals, fit affect many parts of the body, but commonly and na the one wey dey affect the lungs, pulmonary tuberculosis. So na im dey cause TB. And if you get tuberculosis or you know anybody wey get TB, no be death sen ten ce. Dem fit cure am, dem fit treat am. Just that people no dey gree go hospital on time unless e don spread. So if you go hospital, dem go do test, dem go confirm if na TB the person get, dem go confirm. And if na TB, dem go give the person medicine wey e go take for a long while. And when you dey take the medicine, you no need to stop halfway, continue, because if you stop, na problem be that. The medicine fit no work again. So when dem give you medication for TB, you have to continue the medicine and dey go hospital make dem dey check you. E get why you go take am reach, you go dey cure. No need to panic. Okay, the questions are plenty. Oh God, abeg. It says, oh my God, I see. Let me see. It says, what causes delay before urinating? So Israel won't respond.
What causes delay before urinating? Well, if you are having delay, maybe the piece never dey worry you well when I make there was a delay. And two, is there pain when you are having that delay? If there's pain, you go to the hospital. It may be that there's some blockage in some part of your urethra. Yeah, that is causing that, or the bladder itself. Something they block am. If you dey get pain and before urinating. But if there's no pain, that you just the delay, it can still be that some of the muscles of the bladder, they are not working well, they are not contracting well, and they make the urine not they push the urine come out on time. Or maybe you never even ready, piss not they worry you, but you just come out, you just go stand for there before the piss come finally come out. So any of these things can actually cause it. And so the other thing is go hospital so that they will know which of them, and then help you as it should be.
Okay, yeah. So the person wey ask us about hepatitis, sorry, hypertension, the kind food, yes, he say yes, that's the question. So if you get hypertension, the food you need to eat, we call it like the Mediterranean diet. You go need to eat vegetables, eat healthy, eat our normal balanced diet. The best thing to avoid processed food, avoid all those canned food, avoid sugary drinks, avoid alcohol, avoid smoking, exercise, cut down on all those artificial sugars, all those excessive salt intake. Your normal food wey you dey cook are okay for you, but when you come dey add extra salt, when you dey buy all those snacks for road wey dey get high salt intake, or high salt con ten t, those things too fit affect you. So these are the things to do. Vegetables, fruits, and your proteins are healthy for you. your carbohydrates, but you also need proper guidance as well. So we don't know your body weight, so we don't even know if you are obese. And this is why you might also need a nutritionist to properly guide you. But basically, avoid junk foods, avoid energy drinks, and the other ones. I think you should be fine. Okay, let me see. Let me see. Oh God. Okay, let's see. Let me see. Okay, I'm trying to check some questions. No, we don't miss questions quickly. It says, my friend has been bleeding when trying to poo for 3 weeks now. Really scary. Hmm.
When trying to do what?
My friend has been bleeding when trying to, is it poo or pee for 3 weeks now? Is it poo or pee, Seth?
I
Hello?
need to know what he be. Okay, if it's poo, the thing well, I just say more not they assume. So maybe we'll find out what he really be before we answer the question.
Yes, thank you so much, Dr. Israel, for your advice. I also intend to buy a lumbar corset as the orthopedic surgeon advised since I'm a teacher and I stand for long periods. I hope this will help. Yes, it will support you. It will support you. Yeah, it will
Yeah,
support your spine.
it will help.
Oh, okay.
It
When your
will
friend
help.
is trying
So
to, you say when the friend is trying to pass stool, okay, when they try to pull, they see
okay,
blood.
poo.
Okay.
Mm. When your friend they try to pull, they see blood. If the pull they very strong, it means say if like say don't get tear for your hand, so you go they see blood. Another thing is that if the person fit get hemorrhoid, the one we they call pie, you go see the if when we say the hemorrhoid don't injure, if they see blood, and the blood for that one go splash for the body of the toilet, and sometimes it they very red bright red. So when they see such one, you know say yes, maybe you don't get injury. Maybe say you don't get the intestine, the large intestine, the small intestine, there are problems. The large intestine mainly there are problems with it. Dynamic when it is too, you still they see blood, or maybe they infested with some parasitic infection, and when don't they deal with am. So when you get all those kind of infection, when it's too, blood stain fit still follow these two come out. So because of all these things wey I don mention, you know say na wetin you go need to go hospital, so dem make dem check am, make dem know which of them dey really dey cause this blood, and depend on the one wey dey cause the blood, na dem fit know how dem go take manage the person and how dem treat am make e dey okay. Yeah, so please let your friend visit hospital, make e see better doctor, make dem for treat am well.
Dr. Fred, I watch your videos on vaccines for little girls from 9 years old to prevent cervical cancer in the future. Is there any vaccine for boys to prevent prostate cancer? Okay, Pamela, number one, vaccine not dey for prostate cancer, e no dey. But please, no be say boys as well cannot take that vaccine wey be HPV. Boys fit take am o. As a matter of fact, for developed countries, for countries wey get money, wey get good healthcare, the boys can actually take it. But for where we dey, for low and wetin we dey call low and middle income countries or resource poor nations, they don decide say make dem give girls first because the vaccine no plenty to go round. Because if you go give boys now, so many girls fit miss out. Na im dem say they go give girls. But if you dey where the vaccine plenty well well, you dey abroad wey be say dem get am, your boys can also receive the vaccine because the vaccine dey protect you cervical cancer. It can still protect you from other problem wey that virus fit still cause, like genital warts, like even penile cancer and other types of condition. So no be say na just girl, but because of where we dey, na im make us dey put the matter strictly for girls. Okay. Okay, share this video. Share this video. Let's take one more. It says, okay, I did check. It said, good evening. My stomach is always paining early in the morning. What should I do?
Dr. Fred, answer.
Your name na Charity. Your stomach dey pain you early in the morning. So if belle dey pain you early in the morning, you need to find out wetin you sef dey do the night before. How long this non dey do you? Sometimes if e just start, maybe e get wetin you chop the day before and the night before wey make am dey happen, because normally belle no suppose to dey pain you like that early in the morning. But if belle don dey pain you for a very long time, every morning, e go need for you to see doctor make dem check your belle, find out wetin dey happen, and sometimes dem go do test for that belle. So the first thing wey I go tell you be say, wetin you sef dey chop in the evenings wey dey trigger that thing. Find out if maybe you get some kind food wey you dey chop wey make that belle start to dey pain you. Try avoid them first. And if you don avoid all these ones and yet you still dey get this abdominal pain, e dey very bad, abeg you go need to see doctor make dem check you. Is that okay? Now, before we continue again, if you never get this my course on content creation, look Dr. Israel page. Okay, no, let me do like this. Get the course. Scan this code where you dey see for your screen. Scan this code right now. I think it's here, right? This barcode. Take your phone,
No,
snap
the
am.
other side.
On the other side. Oh yeah, sorry. Check the other side. Scan the barcode and then get the course. No need to click on any link. Don't click on any link anymore. As you dey see this live session, so just snap this picture and then scan it. Get the course. It go help you. It go help you so that you no go cry later and say, had I know, I for not do like this. So the title of the course is Guide for New Content Creators. It will help you. Okay, as we prepare to round up today, let's see. Is it compulsory to do circumcision for female child? And if not done, can it actually be any cause of infection for the girl? Osalobua.
There's nothing like female circumcision. Point of correction. In fact, you don't do anything called anything to a girl child. When you do, if they catch you, they're supposed to arrest you. That's called genital female genital mutilation. That's the correct name. Female genital
Yes.
you hear the word female genital mutilation. You know what the word mutilation mean? Me say they commit crime. You they cut what you not supposed to cut. Yeah, so there's nothing like female circumcision. You are not supposed to do it. Yes, we know our grandfather, our forefather, they did it for most women and down in the days, which was wrong. And then they didn't even know why they were doing it. They thought they were protecting something, whereas they were not protecting anything. And they were not protecting anything. So it's not good to do anything like that for your female child. Eh? You are causing problem for your female child. You are making your female child not to enjoy what God don't give and make you enjoy. And it is bad. Because one thing when people they cut, now female they enjoy mekwe, as Dr. Fred they call her. Now female they enjoy that thing. But when you not cut and finish, female not enjoy all you think say you dey help am, say you know what make they move from one place to another, whereas that's what you are already doing to that female person. You dey push am say make you go dey meet from one person to another, because then go dey when the fellow female don dey talk how they take dey enjoy get that satisfaction, and then never get am, they will dey find who go do am for them to get am, whereas you no know say na you and don't go comot wetin go make them enjoy am before. So please don't do anything to any female genital. Don't do anything, leave it. Every as God take create am, leave am like that for her. God know why he do am like that for her. Yeah.
And if dem catch you, you go do jail. If dem catch you, you go enter prison. So many ladies wey dem do am for, they vex for their people wey do am for them. They suffer. The complications plenty well well, plenty wey you no know about. So no allow anybody tell you say make you cut your pikin, because when you cut your pikin, you don affect that pikin for future. Do you understand? This one clear. Oh. This one is very, very, very clear. So do not touch that girl. No touch am abeg. And warn any woman around you. Say we wan do am for the pikin. Me no try am. Now we are about rounding up. Let's see. Okay, somebody says female circumcision or female genital mutilation is a very barbaric act. It was going on in one part of Cameroon too in the past, but has been stopped a long time ago. Thank God they stopped it. Thank God. Christopher says, good evening. I always have cramps pain during my period. And I went for a pelvic scan and I was told I have fibroid. Please, what can I do? Because I'm trying to conceive and I just got married. Please help me. Dr. Israel, I beg. Help him.
Okay, when we talk about fibroid does not have anything to do with you getting pregnant. You can get pregnant. It only depends on where this fibroid is located and the size of the fibroid. So if the fibroid is not big, you don't have problem with it. And you don't have problem with it. Most women have cramps when they are having seen their menses. But the only thing is that how painful is your cramps? That's what it is. That's the problem. And how long does that cramps last? Because the very first day, most people, women, a day before the menses and the very first day, most women get cramps. Then after then, the cramps go disappear, go come dey reduce. But if your own no dey reduce, that is when there is you dey think say, oh, small problem dey. And you say you dey see fibroid, as I said, in fact, most women get that fibroid for their belle. In fact, fibroid na just the muscle of the belle na come overgrow, of the uterus na come overgrow. Na use that kind way take explain am. So most women get that muscles for their belle. Some of them fit overgrow, some fit not overgrow. So if you wan overgrow, no be one say na one serious thing. E now also depend on where e dey located. If e no dey located where pikin go stay, pikin go enter your belle, e go stay. If e no dey where e go block when my oga enter, e release, where e no block where that wetin e release to enter inside your belly, that one go enter, e go fertilize the egg and you go get belle. So no fear. No fear. However, you can see a gynecologist so that if the fibroid don big, say you feel like removing it, or e dey cause you problem, or when you dey see your period, the blood, the bleeding dey many, and you have issue with those ones, then you can actually see your gynecologist. May dem see you and tell you what next to do, so that every other thing can go on well.
Okay, as we prepare to round up, may we try take this last question. I beg, if you not take your question, no vex. We dey try work with time. Is it possible? Is it possible for me to have intercourse, to have mekwe with a hepatitis B patient, not to have it?
Okay, the answer is yes, it is possible. It is possible if you have taken the vaccine. Yeah. So it's for you to go and check yourself first that you are hepatitis B negative. Then you go and take the vaccine. So when you take the vaccine, yes, you can make way with somebody that have it and you will not get it. You will not get it. So first of all, go and take the vaccine and you are 100% safe. And nothing go do you. Mhm.
You don't hear, you don't hear, because whenever you hear hepatitis B, everybody starts panicking. The first thing to do is go and test yourself. If you never test yourself and you dey watch this video, I don't understand where you come from. I don't know. When you've tested yourself and you are negative, take the vaccine immediately. Register and they will tell you the vaccine and when you go come back to complete the dose. And then the person wey dey positive as well, The person too need to go hospital, see him doctor, follow him doctor advice. You are good to go. But not be say because somebody get hepatitis B, you go come dey panic, you no go fit sleep. You go come dey know it's not good. This is why we are here to answer you, to explain and beg you to speak with your doctor. Dr. Israel, any final comments?
Okay, thank you so much. You when they follow us, you when they join us every Sunday from 8 to 9. If we not answer your question, uh, for it could be saying that for some reason, one, maybe we did not see your question or your question came late. Two, maybe you ask question when violates our guideline, and we still get guideline. When would they keep? I believe say Dr. Fred always talk the guideline. One, not ask question when you want us to treat you for here, we no go answer your question. Yeah. So if you violate our guideline, we not go, because I think I saw one question like that where they ask us which medication you go take. We know the answer such question, and we not even read them. And so no verse we no answer. And so what we do here is to educate you people. Is to educate you so that you go get knowledge and you go know what and what to do at each time. Also, if you wish to follow any of us talk, you need to book consultation. All those drop message for our inbox or our private Facebook message, thinking say we go when we answer you, you go just fit they tell us all the issue. You know they work like that. You go need to book for consultation and follow the means where we say make you follow. Then we fit come give you time and follow you talk for some time. Yeah, if you not follow that procedure, ask your question for here, we go answer them for you. Ask your question for here, we go answer them for you. So thank you so much. Thank you so much. We not use your we don't take you for granted. And Dr. Fred, thank you.
Yeah, thank you so much, Dr. Israel. Thank you for joining. I really appreciate it. And now, if you want to join my private Telegram, if you want to join my private Telegram channel, scan this code on your screen. This is the code to join my private Telegram. Scan the code. Don't click on any link. Don't worry. Just snap this picture, then scan it. It will carry you to the place where you fit take do it in register and join my private Telegram. It's very, very, very important. Say I explain them to you. And I want to say thank you. No vex, say we no answer you. This program now every Sunday by 8 p.m. to 9 p.m. We have been doing this for more than 5 years. Every Sunday, and our God they help us. And thank you for always joining us. No be say we just start today. We don't take the do and they come. And all the advice we give you, we they give unto you because we want to make it help you. We know they here because we dey find followers. No, we dey here to advise you correctly. Like I always tell you, good life now waiting. Good life now waiting. Somebody says, please post video on natural contraceptives because that's what is also adding my weight. Okay, no problem. We'll try to work on that. Thank you so much. Like I'll always say, good life in a sense. Take care of yourself
I
and
even dey
have
work on one video. Sorry, Dr. Fred, wait. I dey work on one video on natural contraceptive actually, and I'm taking my time, and that video will be very long, so an episode. So for now, I think I don't get the rough. I reach episode 4, so it's still coming. It never finish. It go reach almost 10 episodes if I'm not mistaken. So I'm working on something on natural family planning already.
nice one, nice one. And if you never follow Dr. Israel, oh yeah, follow Dr. Israel so that may you no miss, may you no miss, may you no miss. Betsy, thank you once again. Thank you for the stuff you sent. God bless you. God bless you. Take care of yourself and have a wonderful week ahead.